Shomit James here at the Neo Medical booth. Death of a spine salesman on the run. Yes, I found Jan Martin. What is your job title at Neo Medical?
Yes, sir. I'm senior director of global marketing for Neo.
God, that's a long one. Does it even say on a business card?
It does.
It does? So Neo Medical, I've seen you guys around. I've seen you at Seton. I've seen Dr. Koufwake use your technology.
Yeah.
It's great. Can you take us through, Mr. Mark?
For those of you out there who don't know, Neo is a Swiss technology company based in Lausanne, which is really the hotbed, and you call it the Silicon Valley of Europe, where all the best MedTech comes out of. That's where Neo was born. Neo was really born to solve the problems that we've all experienced. We've been in the industry for a long time. There's a lot of different medical food systems out there, and nothing's really evolved and changed over the years. And it was our goal with Neo to really develop something new from the ground up, to create a singular platform that can work across any indication, from trauma to degen to deformity to MIS. To make surgery safer, faster, and more
I can see you set up a 2 below, 2 above fracture, right? That's percutaneous.
Yes. So
you did compromising the posterior tension band to get reduction.
We set up a couple different models here. This one obviously is like an MIS deformity. Here, this would be kind of more of a kind of pelvis type of figure to show our rod bending capabilities with the platform. But really, I mean, we work universal. It's part of our name. And that's really because we can do work in any type of procedure. So, I mean, the platform is based off of really kind of 3 main pillars of technology. I mean, the first one is to have implants that are completely universal, right? Cannulated, fenestrated, for open, for MIS, can do reductions, can also take cementation. So instead of having 450 different types of screws, we have, essentially 30 screws. The only thing that's different is the length and the diameter. Yeah, right. So that creates a lot of.
What are your diameters?
So diameters from 405, 50, 60, 70, 80, 80, iliac, 10 iliac.
Really?
We have a whole.
Wow, you're more comprehensive than the deformity system.
Yes.
Yeah.
I mean, and I could show you cases where we've done, 36 screw constructs and with, dual rods and offset connectors and all that type of stuff. But I think our sweet spot really, coming into the U.S. market is in trauma, right? I think trauma is kind of a forgotten procedure for a lot of reps because of the crazy hours and the last minute preparation with SPD and trying to get things organized. With Neo, since we have a sterile platform, it makes it very easy to be prepared, to get moving, and provide them with the latest technology to do those cases, which a lot of times doesn't exactly happen. Yeah, you're just trying to get a step there. So, and that's why we've been very successful in Europe. I mean, we've done 50,000 cases over there.
Yeah.
And we're the 4th largest medical screw company in Germany.
In Germany?
Yes.
The Germans.
Which the German market is the 3rd largest market in the world.
Yeah.
Right? So
they must know what they're doing.
So we proved ourselves, right? They're very process oriented, and I think value-based care is, really taken hold there for efficiency and for cost.
What about their sustainability? Like, are these all being thrown away?
So everything is being thrown away, except sometimes when we have a complex deformity procedure, we do have a reusable tray with in situ benders and rod grippers and all that kind of stuff, right? Because that's cool to have that. But everything else, yes, is single use.
Could we reprocess that? Think about from the 5 that you can't reprocess.
It's not designed. I mean, why would you,
waste in permanent.
Well, you would think that, and a lot of people do make that comment, but we did a life cycle assessment study at a university in Germany.
Okay.
And essentially what it shows is we have a 75% lower environmental footprint than few Viper system that we prepared ourselves.
Yeah, sure.
Right? And where most of that savings is coming from is from sterilization. About 85% is coming from that because of the water, the heat, the chemical, all the energy required to do sterilization is actually really.
No, that's a compelling study. I like.
Yeah, not only that, but if you look at the blue wrap, right?
Oh, 100%.
The blue wraps are made of polypropylene. They basically aren't recyclable.
I started a movement on that where we were actually recycling them.
Yeah.
We would put them aside.
Yep.
And a lot of people would either take them or we were sending them overseas.
Yeah.
And I'd love to see more of that because obviously I'm in the Bay Area. I'm in Silicon Valley, U.S.
Yeah.
and they're very much cognizant of medical waste.
Well, yeah, and if you look at, we did a comparison in Germany as well, and we looked at, a standard region of using Medtronic and all the trays that were wrapped.
Yeah, let's talk about Medtronic. Anything to talk negatively about Medtronic.
Well, just the comparison.
Yeah.
The idea was, let's see how much all of these propylene and all this stuff that's wrapped compared to all of our stuff after clean our boxes, everything once it's over.
Yeah.
And it's about the same. So if you're talking physical waste, it's really no difference.
Yeah. And Jan, let me ask you this, because we have a surgeon out of Encinitas, Dr. Evan Winograd. We love you. Dr. Evan Winograd used to operate in Encinitas. Now, he described an operating room where sterility, they washed instruments. And so I know companies love to talk about, sterility in the U.S., probably because it's such a litigious country, talks about sterility and you have to be in these parameters. But he talks about, again, instruments get washed and reused and cannulated stuff. When we're sitting there as representative using a squeegee to clean them out, their infection rates, they're present, right? Patient costs. It's not truly the instrumentation. That's John Edishami. If you don't believe me, talk to Dr. John Edishami. He says the patient cost, infect. So,
well, you make a good point about the cleaning, right? So, our platform is gamma sterilized one time.
Yeah.
For the patient, it's there.
That's the way to go.
That's it, right?
Yeah.
We're at an ASCUS meeting.
Yeah.
You're absolutely right about the, cannulation. You can never actually get it. Something is washed in a sterilizer, a cleaner and sterilizer, it's dirty forever,
But
right?
I'm saying you shouldn't use your instrumentation as a selling point that it prevents infection, right? You're not doing. Are you doing
Well,
that?
we're reducing risk of infection by almost 80%. Okay. It's only used on one patient, right? So that's,
I know. I love that.
And I think if you look at what CMS cares most about, it's about infection, right? And I think and they're starting to put in more, benchmarks, parameters for reimbursement in connection with if the hospital has lower infection rates. So it really makes sense.
Dude, I'm with you. I'm with you as a distributor because I'm a distributor in my day job, right?
Mm-hmm.
And so I like this for the surgery center, the ASC, right? And I think about just how many sterilizers do they have? Some have to get sterilized at the main hospital, vacuum sealed and transferred over. Yes, that's scary.
Also a trend we're seeing in different parts of the country is they're outsourcing sterilization on site. So it's a couple miles away, and now they're starting to ask reps, distributors, companies to have multiple sets, like if you're working in the VA or something like that. And so the logistical burden is only going to get worse, I think, for distributors for technical, reusable, what I call legacy systems. And eventually, to me, this is going to be the future. It should be the future here.
Dude, you telling me I just bring this in?
Yes.
My gosh, the days of lugging 20 sets? Come on! That's beautiful. Show them the box. Is there a pizza in here? I love it.
Exactly.
Dude, that is great.
So the idea is if you look at the picture on here, this cabinet, right? When you set up
that's gorgeous.
It's 6 feet tall, 2 by 2.
We did that at Medtronic with tissue. Yeah. And still people use it to this day. And you can track par levels. You can track par levels as them. You can track inventory.
Yep.
So as a representative, I do not need to go, here's what you have on the shelf and go.
Yeah.
You should know that hospital.
Yes.
You should know that surgery setup. Thank you.
Yeah.
Because why am I managing your inventory? Yeah. I'm managing my inventory to make sure that every surgeon has whatever they need. Now, I know my surgeons and their screws, their go-to screws, right? So I go heavy on it. So my asset management is top notch because I know them so darn well that they want this 6545 here, 6550. Plus, if we're doing any pre-planning, forget about it. So dude, I'm trying to fall in love. Look at the distal tip of that. It's like
the thread pitch on these is 4 millimeter. It's got a dual
cortical
Gonzalez thread, right? It's obviously cannulated, fenestrated. Our fenestration is kind of on the farther down the tip of the screw, and that's because it helps put the cement when it comes out, farther interior in the body.
Is it directional? Can I know exactly? It just comes out from one area or
Yeah, so
two areas?
it comes out, yeah, both sides, but it kind of comes out as a ball. So the nice thing about
Do you have your own cement?
we'll use this Von OS inject cement, but the idea here is for it to be everything very, very, very simple, right? So if you look at here, putting this in here, it threads in, right? The cannula fits directly into the shank of the screw, right? So it really prevents any
That's
type
a
of
10 screw.
It's a 10 screw.
Yeah.
So we're
Hey, you need for revision, dude. You need that.
I don't know.
How many people have a 10 screw?
Not many people have a 10 screw, and not many people have a 10 screw that's fenestrated.
I have a surgeon
Yeah.
that would enjoy that.
Yeah,
That guy could go big or go home.
exactly. So the idea with this is really, the whole platform is really about giving surgeons like more control, right? And when we're talking cement, the idea is we want to be able to control the cannula from moving, right? So it threads in here, it threads directly into the shank of the screw. And so the diameter of the fenestration is slightly bigger than the cannula, right? So it relieves the pressure when you push the cement through, right? It relieves the pressure slightly, so it kind of balls up around the tip of the screw. And I can show you X-rays.
No, I love to see imaging, and maybe you send it to me so we can
Yeah.
throw it on
Yeah.
especially when you're talking about it, so people know exactly what you're talking about. Because some of the distributors out there, if you're looking for distributors, some of them don't even know that there's options. 100%, right? You're a small company. You have how many people part in the U.S.?
In the U.S., we have probably about 10 people in the U.S.
I remember when you just started.
It was just me and one other guy.
Yeah, I remember that, and you're still aboard, so you must be doing a good job.
Well, I believe
you guys are showing growth.
Yeah, we're showing growth. I mean,
and you're talking about stress on a rod, right? If you're measuring your bending capability. So why is this better than a bending?
So
just tell me, I hate the bending.
A couple different reasons, right? So we're all about minimizing the technology footprint in the OR, right? That's become more of an issue. You got robots, you got athletes, you got all this.
Oh my, I know.
Coming in, right?